Hi, and welcome to LIV1 Health. I'm Jessica Raymond, co-founder and CEO of LIV1 Health, and a nurse practitioner with over 20 years of experience in the traditional medical field. Throughout my career, I cared for patients across the entire spectrum of care, from nursing homes to the emergency department and throughout their hospital stays. Over time, I began to see a pattern. I saw what happens when proactive care is delayed. I saw the downstream effects: preventable chronic disease, cognitive decline, loss of independence, and families facing diagnoses that might have been avoided with earlier intervention, clarity, and accountability. And I knew something had to change. Personally, I didn't want that future for myself. I didn't want to lose clarity. I didn't want to be diagnosed with a preventable disease. I didn't want to hand over control of my health because I had ignored it for decades. Working as a hospitalist, I met Justin Main, also a nurse practitioner with years of experience as an ICU nurse and a fellow hospitalist. We met in the physician's lounge of a prominent healthcare system, and not long after, we went through the COVID pandemic together. We experienced the PPE shortages, the exhaustion, the intensity of acute care at its breaking point. And more than anything, we saw how vulnerable people were when their health had not been built with resiliency in mind. That season solidified something for us. Reactive medicine was not enough. So Justin and I joined forces and co-founded LIV1 Health to build what we believe was missing all along. At LIV1, our mission is to provide precision healthcare, unlock human performance, and create legacy-level standards that can transcend generations to come, all while ultimately redefining the average experience of everyday life. But we also believe something even simpler. Average is broken, and it's time to redefine it. When you look at the average American today, the reality is hard to ignore. Most are overweight, many have at least 2 chronic conditions, energy is low, stress is high, marriages are strained, financial pressure is constant. That has quietly become normal. But that is not the standard we are going to accept. I used to hate the word average because average shouldn't look like disease, exhaustion, and decline. To me, average should look like being in a room where most people are strong, fit, mentally sharp, traveling, running around with their kids, laughing with their grandkids, learning new skills, and living fully all the way to the very end. The truth is, the seeds of chronic disease are planted early, in your 20s, 30s, and 40s. They're watered by sedentary lifestyles, chronic stress, poor sleep, reliance on alcohol or nicotine to cope, endless scrolling to numb the mind, and a lack of disciplined action. Those seeds quietly grow. They show up as low energy, fatigue, weight gain, muscle loss, low libido, brain fog, and we normalize it. We say, well, I'm just getting older, until one day a diagnosis demands attention. Diabetes, heart attack, stroke, dementia. And by then, often the damage has already been done. You have one mind, one body, and one life. It must be treated that way from the beginning. We can't prevent everything. We can't control every outcome, but we can build resiliency. We can eliminate constraints. We can become the strongest, most prepared versions of ourselves, physically and mentally, so that when life happens, we are ready. We believe in being the warrior in the garden, capable, disciplined, ready to fight if needed, but also present enough to watch the sunrise, to travel the world, to stop and smell the roses, to play with your grandkids, to keep learning, to keep setting new records in your own life. At LIV1, we leverage advanced biomarkers alongside uncompromising accountability to optimize biology and engineer behavior, building durable resilience that compounds over decades. This is not average healthcare, and we don't work with clients who want average results. Excellence is earned. Every decision compounds forward or pulls you backwards. Accountability is non-negotiable. We are building something bigger than individual transformations. We are building generational health. Our vision is to set the new standard for health and human performance by uniting medical providers, health coaches, and performance professionals into one disciplined system of care. We are not simply optimizing individuals. We are architecting the blueprint. And now you are a part of that. When you join LIV1 Health, you are not stepping into a passive patient role. You are stepping into ownership, into clarity, into a higher standard, into the driver's seat of your own health. We will guide you. We will challenge you. We will hold the line with you, because what's at stake is not just how you feel next month, it's the trajectory of your life. This is how the standard is raised. This is how average is redefined. Welcome to LIV1 Health. Let's build something that lasts together.